All right, we're going to go ahead and get started. Welcome to our webinar series presented in conjunction with HealthTrust Slice of Life program. We're your hosts, Olivia Rowe and Ashley Benningfield.
Olivia is from a small town in Pennsylvania, just outside Williamsport, the home of the Little League World Series. She graduated from Ithaca College with a degree in television and radio communications and a concentration in screenwriting. She's worked as a writing assistant and an editor, and she moved to Nashville, excuse me, in 2016. She joined Onlife Health in January as the manager of content and digital media. She loves hiking, listening to podcasts, and spends much of her free time writing fiction and watching documentaries. Olivia considers herself a news junkie who's obsessed with pop culture trivia.
Ashley is originally from Germantown, Tennessee, right outside of Memphis. She graduated from UT Knoxville with a degree in dietetics. She completed her dietetic internship at Vanderbilt University. Ashley is a registered dietitian technician, and she's been at Onlife for about 14 years. She currently serves as our content and digital media specialist. Onlife Health is the only place Ashley's ever worked. She loves spending time with her husband and 6-year-old son, working out and listening to Jason Aldean.
So for those of you that have joined us before, welcome back. And for those of you who may not have had the chance to join us, welcome. As we mentioned last time, we're both new to these webinars, so we appreciate your patience and welcome any feedback. We look forward to interacting with everyone today.
So today we'll be breaking down our topic, Complementary and Alternative Medicine, the Hope and the Hype. So before we start, just wanted to give you a couple of notes about the webinar itself. It's being conducted in a listen-only mode, so you can hear us, but we can't hear you. We'll ask you a question at the beginning of the presentation, and then also the last 10 to 15 minutes of the webinar have been set aside for any questions or answers that you might have. And even though we can't hear you, you at any time can type questions in the questions box, I think it's a chat box, at the bottom of your control panel. We'll try to answer as many of those questions as possible during the Q&A portion of the webinar. Also note that the webinar is being recorded. So without further ado, let's jump on in. So we wanted to start by hearing from you. Do you currently use any complementary and alternative health practices? If so, what is it and why do you use it? Go ahead and type your answers in the chat box. Essential oils, it's a good one, it's a popular one. Chiropractic care, another good one. Acupuncture, massage therapy. Reiki, yeah. Chiropractor, not sure of your definition, but yoga is an everyday part of my routine. Yeah, yoga counts. We'll be talking about that in the presentation, actually. We'll get into some of the more popular ones that a lot of people are using. Yoga, massages, Pilates. Yeah, all of these fall under this presentation. Okay, so we're gonna go ahead and move on here. So it's estimated that more than 30% of American adults use products and services that are not considered conventional health practices. And every 5 years, there's a survey that assesses how Americans embrace these approaches. So the most recent one showed that about 33% of American adults use complementary health practices. And the survey showed that there was actually a significant uptick in out-of-pocket dollars spent on chiropractic care and acupuncture, both of which were mentioned in the chat. And that suggests that Americans might be relying more and more on holistic practices than ever before. So from treating anxiety to lower back pain to tension headaches, These practices have been called natural cure-alls.
So today we'll define complementary and alternative medicine, and then we'll briefly touch on some of the most popular types of complementary and alternative medicine. We'll also take a look at the risk and benefits of them and look at what research says about them. And then, as Olivia alluded to previously, we will end with Q&A.
So let's start by kind of breaking it down and defining what exactly it is. So complementary and alternative medicine is often referred to as CAM for short. It's a term that's used for a variety of healthcare practices and products that might be used along with conventional medical treatment, like when you go to the doctor. CAM includes mind and body practices like acupuncture, natural health products like dietary supplements, and alternative health approaches like traditional Chinese medicine. People often use complementary practices along with their doctor's care to deal with chronic health problems, treat symptoms, or just to stay healthy. The terms alternative and complementary are often used interchangeably, but the two words actually mean different things. So complementary means in addition to. So if the practice is used together with conventional medicine, it's considered complementary. So an example of this would be using massage therapy along with prescription medications to treat anxiety. And if the practice is used in place of traditional medicine, it's considered alternative. So complementary and alternative medicine varies in terms of the treatment, the extent of the therapy, and the types of problems that it helps. It's important to discuss any treatments with your doctor and make sure that they don't replace your medical care. So now let's take a look at some of these practices.
The first one that we're going to take a look at is called Ayurveda. This is a holistic practice that places great emphasis on prevention and encourages the maintenance of health through close attention to balance in life, thinking, diet, lifestyle, and the use of herbs. People in India have used this practice for more than 5,000 years. According to this practice, there are 5 elements of nature: space, air, fire, water, and earth that combine in the body as 3 components. These components are referred to as doshas. They are Vata, Pitta, and Kapha. And these doshas relate closely to the basic elements of nature and to specific functions of the body. And Olivia is going to talk about those in just a minute. And in Ayurvedic medicine, a balance of these doshas is thought to be required for optimal health. If an imbalance occurs in any of the 3, illness results.
So each person has their own pattern of energy, which is a combination of physical and emotional characteristics. This makeup is determined at conception by a variety of factors, and it stays the same throughout your whole life. And there are many internal and external factors or stresses that act to disrupt this balance. So the examples would include diet, physical trauma, relationships, and even the weather. Now, once these factors are understood, someone can take actions to lessen their effects and reestablish balance. Balance is a natural order, and imbalance is disorder. Health is order, and disease is disorder. Within the body, there's a constant interaction between order and disorder. And when you understand the nature of disorder, you can reestablish that balance.
So the first dosha is Vata, and it's composed of air and space, and it controls muscle and joint movement, breathing, and heartbeat. It also controls anxiety, fear, pain, and other functions of the nervous system. And in balance, Vata promotes creativity and flexibility, but out of balance, it produces fear and anxiety.
Next is Pitta. It's made up of fire and water and controls bodily functions like digestion, metabolism, and body temperature. In balance, it promotes understanding and intelligence, but out of balance, it governs the emotions of anger, hate, and jealousy.
And then the third dosha is Kapha, and it's represented by earth and water. It governs the physical structure of the body and the immune system. And in balance, it is expressed as love, calmness, and forgiveness. And out of balance, it leads to attachment, greed, and envy.
So some people use Ayurvedic practices to maintain health, reduce stress, and improve flexibility, strength, and stamina. practices like yoga and meditation can be helpful for people with diseases like asthma, high blood pressure, and arthritis.
The next one that we'll talk about is traditional Chinese medicine. This is a system of medicine partly based on the idea that an energy, or qi, flows along pathways in the body called meridians. In this belief, if the flow of qi along these meridians is blocked or unbalanced, illness can occur. In China, doctors have practiced traditional Chinese medicine for thousands of years, and it's gaining in popularity in many Western countries. So there are several causes of qi imbalance, and they are thought to be external forces like wind, cold, or heat, internal forces such as emotions of joy, anger, or fear, and lifestyle factors like poor diet, too little sleep, or too much alcohol.
So another important concept in traditional Chinese medicine that you may have heard of is the concept of yin and yang. So in this approach, all things, including the body, are composed of opposing forces called yin and yang. Health is said to depend on the balance of these two. Now, traditional Chinese medicine focuses on looking at the balance of the body, mind, and spirit to determine how to restore qi, the yin-yang balance, and good health. Doctors that practice traditional Chinese medicine often use it to treat problems like asthma, allergies, and infertility.
So there are several types of treatment that can be used to restore qi balance. Some of these include acupuncture, acupressure, Chinese herbs, cupping, diet, and massage.
So research has shown this medicine to be helpful for many types of illness. However, because it differs from Western medicine in diagnosis and treatment, it's hard to apply Western scientific standards to it. For example, in Western medicine, any two people with a similar infection might be treated with the same course of antibiotics. But in Chinese medicine, each person might receive a different treatment for the same illness, depending on that person's own qi and the yin-yang balance. Now let's move on to homeopathy. So, otherwise known as homeopathic medicine, it's a medical philosophy and a practice that's based on the idea that the body has the ability to heal itself. It was founded in the late 1700s in Germany, and it's been widely used throughout Europe. This medicine views symptoms of illness as normal bodily responses as it tries to regain health. So homeopathy is based on this idea that like cures like. So if something causes a symptom in a healthy person, giving that person a very small amount of the same thing may cure the illness. A homeopathic health practitioner uses pills or solutions that have only a little of an active ingredient for treatment of disease. These are known as highly diluted substances. There isn't strong evidence to show that homeopathic medicines are effective for any specific condition.
Some people have used homeopathy to maintain health and treat a variety of long-term illnesses like allergies, arthritis, including rheumatoid arthritis, and irritable bowel syndrome. They've also used it to treat minor injuries like cuts and scrapes, as well as muscle strains or sprains. Homeopathic treatment is not considered appropriate for serious illnesses like cancer or heart disease.
So is it safe? Homeopathic remedies have been regulated in the US for decades. They're thought to be safe in most cases, but some of the products might cause side effects. There is not any evidence to show that you can safely use these products instead of getting recommended shots or vaccines. Some critics of homeopathy believe that there is so little active substance in the solution that any benefits from treatment are probably not because of the substance, but because you think it's working.
The next one we'll talk about is naturopathy. Naturopathic medicine, otherwise known as naturopathy, is based on the belief that the body can heal itself. It tries to improve health, prevent disease, and treat illness through organic foods and exercise, a healthy lifestyle, and other alternative treatments, including Ayurveda, homeopathy, and herbal therapies. So naturopathy has been around since the late 1800s. Today, a licensed naturopathic doctor attends a 4-year graduate level medical school. They study basic sciences and therapies like herbal medicine, homeopathy, and bodywork. Naturopaths might attend training programs, but they generally are not licensed. Most naturopathic doctors and naturopaths believe in natural therapies like lifestyle counseling and nutrition, and they generally avoid prescription medicine, but they might prescribe herbal medicines or supplements. And not all states require that these doctors be licensed, and many training programs differ.
So what is it used for? Most naturopathic doctors can treat earaches, allergies, and other common health problems. Is it safe? Two common concerns about naturopathy are the use of fasting and a bias against vaccines. Always talk with your medical doctor before fasting, as it can be dangerous, especially if you have a disease like diabetes. Some naturopathic doctors and naturopaths do not believe that vaccines are necessary, but medical experts overwhelmingly recommend vaccines. And as we've seen, a lack of vaccination has led to major upticks in preventable diseases like measles.
So now we'll move on to mind and body practices. And these develop the mind's ability to help the body to heal or keep itself well. Some of the practices, like cognitive behavioral therapy, used to be considered complementary medicine, but they're now part of conventional medicine in the United States. Mind and body practices include a variety of procedures or techniques that are administered or taught by a trained practitioner or teacher. Some of the most popular practices among adults are yoga, chiropractic care, and meditation. You may have noticed that even in recent years, the popularity of yoga has grown dramatically. In 2012, just under 10% of US adults practice yoga, and in 2017, that number jumped to 14.3%. The use of meditation has also increased more than threefold, from 4.1% in 2012 to 14.2% in 2017.
Other mind and body practices include acupuncture, relaxation techniques like breathing exercises and guided imagery, Tai Chi, hypnotherapy, and Pilates. The amount of research on mind and body approaches varies depending on the practice. So, for example, researchers have done a lot of studies on acupuncture, yoga, chiropractic care, and meditation, but there have been fewer studies on some of these other practices. Today, we wanted to touch on a few of the most popular ones.
So the first one is acupuncture. Acupuncture is a form of traditional Chinese medicine that has been practiced for centuries. It's based on the theory that energy flows through and around your body along pathways called meridians. Acupuncturists believe that illness occurs when something blocks or unbalances your qi. Acupuncture is a way to unblock or influence that qi and help it flow back into balance. Acupuncture is done by putting very thin needles into your skin at certain points on your body. This is done to influence the energy flow. And sometimes heat, pressure, or a mild electrical current is used along with the needles.
So let's break down what exactly happens during acupuncture. So your acupuncture provider will give you an exam and ask questions about your pain and how well you're functioning and about your overall health. They will then look for the places called points on your body to access the qi that's blocked or not flowing correctly. Now, each of these points relates to certain health problems or body functions. Your provider will look for landmarks on your body using certain muscles or bones, for example, to find the points so that he or she can place the needles. After the provider finds the points, they'll quickly tap very thin needles into your skin. There may be several needles used, and some may be placed deeper than others, depending on what the provider believes is needed to restore the flow of qi. Now, in most cases, acupuncture treatment lasts for 15 minutes to an hour, and you may have several visits to complete your treatment, and some people have ongoing visits.
So when you hear about the needles being placed into your skin, you might automatically think that it hurts, but most people find that it actually doesn't. You may feel a slight pressure when the needle goes in. The area may tingle, feel numb, itch, or even be a little sore. Providers believe that this is a sign that the energy flow has been accessed. After the needle is placed, your provider may roll it slightly back and forth, or they may use heat or electrical current on the needle. Some people use acupuncture to relieve pain, like low back pain, or to manage chronic pain from osteoarthritis, headaches, or neck problems. There is some evidence that acupuncture may help to treat pain, but in most cases, the studies have been too small to clearly show a benefit. And overall, acupuncture is safe when it's done by a certified provider. A state license ensures that that provider has a certain level of training and follows certain guidelines.
All right, so the next one that we have is music therapy. Music therapy uses music for physical and emotional healing and wellness. It involves a trained and certified music therapist who may have sessions with clients that involve listening to music, making music, or a combination of the two. Music therapy has been shown to help people express themselves, find new memories, and calm the body and mind through its rhythm. It can also help reduce your heart rate and blood pressure, as well as increase your ability to think, learn, reason, and remember. It's sometimes used in conjunction with movement therapies like dance. Research in music therapy supports its effectiveness in many areas. For example, it may improve forgetfulness by improving your connection to others, helping the brain produce a calming substance, improving how well you speak, and improving long-term and medium-term memory. Music therapy may also help children deal with necessary but painful procedures. It's also used to reduce the pain of cancer treatments. Music therapy is considered safe as it's a healthy way to express yourself.
Light therapy is exposure to light that's brighter than indoor light, but not quite as bright as direct sunlight. During this type of therapy, you sit or work near a device called a light therapy box, which gives off bright light that mimics natural outdoor light. Light therapy can help with depression, jet lag, dementia, and sleep disorders. It can also help reset your biological clock to manage sleeping and waking patterns. So light therapy is believed to affect brain chemicals that are linked to mood and sleep. It's sometimes used to treat seasonal affective disorder, commonly known as SAD, a type of depression that generally occurs during the wintertime when the days are shorter and there's less sun. Most people who deal with SAD feel better after using light therapy, likely because it helps replace the sunlight that's absent in the winter and it resets the body's internal clock.
So light therapy is usually most effective first thing in the morning when you wake up, but your doctor or your therapist can help you figure out when it works best for you. You will usually respond to this therapy within 2 to 4 days, but it might take up to 3 weeks of this therapy before symptoms of SAD are relieved. It's not well known how light therapy works during other times of the day, but some people with SAD might find it helpful to use light therapy for 1 to 2 hours in the evening. Just make sure you stop at least 1 hour before bedtime.
You want to make sure that you don't use ultraviolet light, which can damage your eyes and skin, or full spectrum light, heat lamps, or tanning lamps. There are many light therapy lamps designed specifically for this purpose. Overall, it's generally safe and can be used with other treatments. If symptoms of depression do not improve or if they become worse, it's important to follow up with your doctor or therapist. And people with sensitive eyes or skin shouldn't use this therapy without talking to a doctor first. There are a few side effects of light therapy. These include eye strain, headaches, agitation, nausea, and sweating. They may go away on their own after a few days, but if they persist, try to decrease the amount of time that you spend under the light and move further away from the light and take breaks between long sessions. Massage is rubbing the soft tissues of the body, such as the muscles. It may be, it may be helpful in reducing tension and pain and improve blood flow and encourage relaxation. Massage therapists usually apply pressure with their hands, but they can also use their forearms, elbows, or feet. And there are at least 80 different types of massage. I didn't know that, did you?
Nope.
Some are gentle and some are very active and intense. For example, a Swedish massage is very gentle and is often used to promote relaxation and relieve muscle tension. With this type of massage, the therapist uses long gliding strokes and kneading or tapping techniques on the top layer of the muscles in the direction of the blood flow to the heart. This may also include moving the joints gently to improve range of motion. Deep tissue massage is more active and intense. and it's used to treat long-lasting muscle tension. In this type of massage, the therapist applies slow strokes using intense pressure to reach deeper layers of the muscles than those reached with the sweetest massage.
So some people feel that massage works because the touch is healing, and touch also communicates a sense of caring. You can use self-massage to unwind after work or school, or to energize yourself in the morning. You can easily massage your feet, hands, or neck while doing other tasks or while relaxing. Self-massage works best if you're in comfy clothes and are sitting or lying in a comfy position. When done properly, massage is considered safe, but you should talk to your doctor before you get one if you have open wounds, bruises, or areas of weak skin, you have a blood clot in a vein, or you have a bleeding disorder or take a blood thinner. But keep in mind that massage may be expensive and it's generally not covered by insurance and requires a time commitment.
So now we're going to talk about yoga. Yoga is a mind and body practice that involves movement, breathing exercises, and mindfulness. It started in ancient India as a spiritual practice based on the idea that the mind and body are one. Today, yoga has become increasingly popular and part of mainstream culture, with more and more people practicing it for overall health, stress relief, and fitness. There are many different styles of yoga. While their styles differ, they all include stretching postures that are done with focused, deep breathing. You can practice yoga alone at home with just a mat and a great YouTube video, or in a class with other students. And whether you're a beginner or advanced, there are different types of classes for all skill levels. Some of these focus on movement and technique, while others place an emphasis more on stress relief and mindfulness. And classes often take place in a yoga studio, but they can be taught anywhere, including outside. Yoga can be helpful for physical problems such as back pain or other health issues, along with regular medical treatment. Most experts consider it to be safe when used by healthy people and taught by a well-trained professional. But like any activity, yoga can cause muscle strains or sprains, so know your limits and adapt the poses to work with your body's needs.
So now let's move on to natural products. So these are substances that are found in nature and they're used to treat illness or promote wellness. They include foods, vitamins, and both herbal and non-herbal dietary supplements. So this group includes a variety of products like herbs, vitamins, minerals, and probiotics. And they're widely marketed and they're available to consumers, often sold as dietary supplements. So according to a recent survey on the use of alternative health approaches by Americans, about 17% of American adults had used a dietary supplement other than vitamins and minerals in the last year. These products were the most popular complementary health approach in the survey, and the most commonly used natural product was fish oil. So while there are indications that some may be helpful, more needs to be learned about the effects of these products in the human body and about their safety and potential interactions with medicines and other natural products.
Moving on to melatonin. This is a hormone made by a small gland in the brain that helps control your wake and sleep cycles. And very small amounts of it are found in foods like meats, grains, fruits, and veggies. Your body has its own internal clock that controls your natural cycle of sleeping and waking hours. In part, your body clock controls how much melatonin your body makes. Normally, melatonin levels begin to rise in the mid to late evening, remain high for most of the night, and then drop in the early morning hours. Light affects how much melatonin your body produces. During the shorter days of winter, your body may produce melatonin either earlier or later in the day than usual. This change can lead to symptoms of SAD. Natural melatonin levels slowly drop with age, and some older adults make very small amounts of it or none at all. You can buy melatonin as a supplement. You may have heard of people taking these supplements before bed to help them sleep. In addition to sleep problems, melatonin supplements are sometimes used to treat jet lag. But scientists are also looking at other good uses for it, like treating seasonal affective disorder, helping to control sleep patterns for people who work the night shift, preventing or reducing problems with sleeping and confusion after surgery, and reducing chronic cluster headaches. And in most cases, melatonin supplements are safe in low doses for both short and long-term use. and children or pregnant or nursing women should not take melatonin without talking to their doctor first. Melatonin does have side effects other than sleepiness. They include lower body temperature, vivid dreams, morning grogginess, and small changes in your blood pressure.
Now let's move on to St. John's Wort. So I've heard of this supplement, but I didn't know that it came from this plant, which looks very nice, that has yellow flowers that people in European countries have used for centuries to treat mild to moderate depression. So in the US, it's sold as a dietary supplement, and it can be found at health food stores and pharmacies. So St. John's Wort is used in the short-term treatment of mild to moderate depression, and it may take up to 2 to 3 weeks for it to improve depressive symptoms. It causes fewer side effects, like digestive discomfort or headaches, than antidepressant medicines, although it may cause a rash with sun exposure. St. John's Wort may interact with medicines used to treat some other illnesses, such as AIDS, and you shouldn't take it while you're taking other antidepressants. You may over-medicate yourself, resulting in serious side effects. So it's important to let your doctor or pharmacist know if you want to try St. John's Wort so that he or she can determine whether it might interfere with other medicines that you're taking. You should not take St. John's Wort if you're pregnant or breastfeeding.
Another popular one is tea tree oil. It can kill bacteria and fungi, and it comes from the evergreen leaves of an Australian tree. It's been used as a complementary therapy in surgery, burn care, and dental care. Numerous tea tree oil products are available, including soap, shampoo, toothpaste, lip balm, topical cream, which is used on the skin, and essential oil. People usually use it to treat minor cuts, burns, acne, athlete's foot, mild fungal nail infections, and vaginal yeast infections. Although there is little research on tea tree oil, some studies suggest that it's safe and often effective for the prevention and treatment of infections. It can also be used as a chemical-free mouthwash or a natural deodorant, or to treat inflamed skin and conditions like psoriasis. Experts consider tea tree oil to be safe as a topical treatment, and you can apply it directly to the skin on a daily basis. When applied to the skin in its purest form, it seldom causes irritation. However, some people may develop an allergic rash. So if you're concerned that you might develop a rash, try the oil first on a small area of your skin. You can also dilute it with vegetable, olive, or almond oil. Tea tree oil is not safe to swallow, and is also not recommended for use in the ears because it may cause damage to the inner ear.
Okay, so another popular one, probiotics. So probiotics are bacteria that help keep the natural balance of organisms in your intestines. They're often referred to as friendly bacteria or good bacteria. They help to reduce the growth of harmful bacteria and promote healthy digestion. So the normal human digestive tract contains about 400 types of probiotic bacteria. And the largest group of this bacteria in the intestine is lactic acid bacteria, like that found in yogurt with life cultures, which is the best known. It has been suggested that probiotics be used to treat problems in the stomach and intestines, but only certain types of bacteria or yeasts have been shown to work in the digestive tract. It still needs to be proven which probiotics work to treat diseases. So at this point, even the strains of probiotics that have been proven to work for a specific disease are not widely available.
Many people use probiotics to prevent diarrhea, gas, and cramping caused by antibiotics. Antibiotics kill the good or beneficial bacteria along with the bacteria that cause the illness. A decrease in beneficial bacteria may lead to digestive problems and infections such as vaginal yeast and urinary tract infections. But taking probiotics may help replace the lost beneficial bacteria. Probiotics are available to consumers mainly in the form of dietary supplements and foods. Most probiotics are similar to what is already in a person's digestive system. Some have been used for a very long time, such as in fermented foods and cultured milk products. These don't appear to cause illness, but more study is needed on the safety of probiotics in young children, the elderly, and people who have weakened immune systems.
All right, so let's move on to chamomile, which is another cool looking flower. So it's an herb that people have used for centuries. And people in the US probably know it as a tea to calm an upset stomach or to help with sleep. German and Roman chamomile are two types of chamomile to use for good health. So German chamomile is used and studied the most, and it's been approved for use on the skin to reduce swelling and fight bacteria, and as a tea or dietary supplement for stomach cramps. People use German chamomile to treat irritation from chest colds, slow healing wounds, gum inflammation, and skin conditions like psoriasis, eczema, and chickenpox. Roman chamomile is used as a tea to treat an upset stomach, sleeping problems, or menstrual cramps. You can buy chamomile as dried flower heads, an infusion tea, liquid extract, and in creams and ointments. The pollen that's found in chamomile preparations may cause allergic reactions. So if you're allergic to ragweed pollen, you may not be able to use it. Chamomile may also interfere with blood thinners. So let's get into some of the risks of complementary and alternative medicine. So as with any medical therapy, there can be risks associated with it, and they depend upon the specific CAM treatment. So the following are general suggestions to help you learn about or minimize the risks. So the greatest risk is that you may use these treatments instead of going to your regular doctor. A complementary medicine should be used in addition to treatment from your doctor. Otherwise, you may miss important treatment that could save your life. Some natural products may be safe when you take them on their own, but they might not be safe if you have other medical problems. And they could be dangerous when they're combined with another medicine that you take. So to be safe, always check with your doctor before you use any natural products or supplements. So for example, herbal or botanical products and other dietary supplements may interact with medications, and that's prescription or non-prescription. So research has shown that St. Johns Wort, for example, which I mentioned is used by some people to treat depression, that can cause certain drugs to become less effective.
Natural products can vary widely in how strong they are, and they may also contain harmful things that are not listed on the label. Your doctor or practitioner may be able to recommend a brand that you can trust. Also, complementary medicine isn't controlled as much as standard medicine. This means you could become a victim of fraud. Sellers or people who practice complementary medicine are more likely to be frauds if they require large upfront payments, promise quick results or miracle cures, and warn you to not trust your own doctor.
So now that we've covered the risks, let's get into the benefits. So one benefit to alternative and complementary medicine is that many people who practice it take a whole person or holistic approach to treatment. So they might take an hour or more to ask you questions about your lifestyle, habits, and background. And this makes many people feel better about the treatment, the person giving the treatment itself, and the condition. And these alternative treatments may cost less and have fewer side effects than standard medicine. And these treatments are also more widely available in less developed parts of the world. And some people also feel more in control when they are more involved in their own health. And since most complementary medicine looks at the connection between the mind and the body, many people who use it feel better. They like working toward overall wellness rather than just relief from one problem.
So if you're considering using one of these approaches, here's what you should know. The Food and Drug Administration does not regulate dietary supplements in the same way that it regulates medicine. A dietary supplement can be sold with little or no research on how well it works. As we said, always tell your doctor if you're using a dietary supplement or if you're considering combining one with conventional medical treatment. It may not be safe to rely solely on a dietary supplement, and this is especially important for women who are pregnant or breastfeeding. And finally, when using dietary supplements, keep in mind that the side effects and the effectiveness of them may differ among the brands or even within different lots of the same brand. The form that you buy in health food or grocery stores may not be the same as the form used in research. The long-term effects of most dietary supplements, other than vitamins and minerals, are not known, and many aren't even used long-term.
So on this slide, we've included some additional resources for you, and these are also included in the handout, which I think someone asked me about earlier, which I didn't get a chance to answer. So the handout should be available within the control panel that you're looking at. There should be like a little section that says handouts, and you should just be able to download it from there. And that includes all of these links. But if you have trouble or you can't find the handout, you can feel free to email me directly. In a day or two after the webinar is over, you'll receive a follow-up email, and that follow-up email will contain my email address. So feel free to send me an email if you have any questions or if you are not able to access this handout.
So we want to hear from you now. What are your feelings about complementary and alternative medicine? If you're not already incorporating it into your lifestyle, do you plan to do so? If you want to type your responses in the chat box, feel free to do so. And I guess if you have any other questions.
Yeah, if you have questions or comments about if you plan to incorporate it, yeah, send us a little note. There we go. My cursor wasn't working. Can I share the PowerPoint presentation? Someone has asked. So if you mean after the webinar is over, you should be able to see it now, I would hope. But if you mean after the webinar is over, you should receive a recording within a couple of days with all this information. We heard that, Vicky, I think you're referring to CBD oil. I have heard that can be useful for like sleep and anxiety. I don't know that much about it. That's something that you should for sure talk to your doctor about. May look into the practice of yoga. Yeah, yoga is it's pretty awesome. I use it sometimes when I'm like stressed out. It just helps like the body relax and the mind relax.
Oh, good.
Oh, you've used at least 6. Yeah, some of these like I thought were more mainstream. Some of these treatments I thought were more mainstream and didn't realize they were considered alternative medicine, like yoga and meditation. But I guess like after we kind of went through the information, it makes sense. Massage has helped a lot.
I like the deep tissue massage the most.
Don't intend to use it. You think you'll follow your doctor's advice. Hey, I mean, that's good. And your wife uses some form of CAM. Okay, cool. Is there a reason you didn't include, right? No, there isn't. There's a lot. There's so much within this topic. I mean, we could have been here for like 6 hours talking about everything.
And to be honest, I've never even heard of Reiki. What is it, Reiki? Right?
Yeah, it's like a form of I think yoga.
Oh. Well, I didn't even know there was how many types of massage? 80, and then all that yoga. Different types of yoga.
Someone said they use CBD oil for chronic back pain and insomnia. And they suggested talk to your doctor about recommending which strength to start at. Yeah, that's a good idea for sure. This is very informational. Good.
Good.
Look for massage therapy for headaches and upper back pain. Yeah. Food. Someone said they have food allergies and a naturopathic doctor helped them. That's great. I love massage. Yeah, same.
Me too.
Good. We're glad that you found it to be informative. We're kind of worried it was a little
Yeah, it was a lot of-
information heavy.
Very information heavy, but we're glad that you enjoyed it.
Someone asked if they can get a copy of, so, yeah, so as I said, you'll receive a recording after, but I think I can send it to them.
Yeah.
But, if you email me, I can send you, a copy, like a copy of just the PowerPoint if you don't want to go through the whole webinar again.
So reputable places that offer these services, you mean specific to your area, or the list on the additional resources page might help you out as to like reputable sources for more information. But as far as what was in your area, I'm not sure. Do you know? I'm not sure.
I don't believe
No.
most people need, yeah, I don't think you need a referral to see a chiropractor. You should just be able to go like straight in there and talk to them. Someone said they've used CBD oil for back pain and anxiety, but it was not effective for them. They tried different brands, but none of them worked. And the prices also vary greatly in where it is produced. Yeah, that makes sense. I think it probably is something that works for some people and not for others. Oh, here's someone who mentioned about Reiki. One of the basic ideas held by those who practice Reiki is that this vital energy can be channeled to support the body's natural ability to heal itself. Yeah, that's pretty cool.
Oh yes, in the area. They're hard to find.
So, someone asked about reputable places to look for some of this stuff. So, I don't have any like to offer you right now, but again, if you send me an email, I can definitely help you out further, for what you're looking for. I can guide you to some good resources to help you find what you need. Okay, is there anything else?
So I think our next one is on December or November.
Our next
November
webinar
13th.
is in November, I think the 13th, and it's on diabetes. So we hope to see you there for that one. You should, as I said, be getting a follow-up email within the next, I would say, like couple of days with a recording of the webinar, and that will have my email address on it. So if you have any questions about anything, or if you need more resources or some help, feel free to send me an email and I'll respond to you pretty quickly.
Thank you.
Thank you so much for joining us.